For joining us this hour. Rachel's on vacation, and we start tonight with a man in Virginia named Travis Campbell. He's been in the hospital for more than a week now because of complications from COVID-19. He was unvaccinated. So were his wife and their children. They all caught the virus in July. His wife explained to NBC, quote, "We just thought we were invincible and we weren't going to get it." Now he's in the ICU, struggling to breathe, and he has this urgent warning for anyone who, like him, has still not gotten their COVID vaccine.
This Delta strain is something else. I would ask you, if you thought that you had to sit down and plan your goodbyes and funeral, or go get the COVID vaccine, what you do? I'd hope to God that all my friends and family would not say, "Somebody hand me a piece of paper and a pen." That's a sobering thought, of which I have done. I have planned. Last night, my wife and I had to make a decision if I was going to allow them to put me on a ventilator. Worst case scenario. And I don't want to be on one, but I want to live.
I want to live. As far as how his family is doing, he gave this update in a Facebook post last week. Quote, "My whole family has COVID. I truly regret not getting the vaccine. I'm testifying to all my bulletproof friends that's holding out. It's time to protect your family. It's not worth getting long-term lung damage or death. Please go get the vaccine. When I hear my kids with the rattle lung cough, when they say they're so dizzy they're getting sick, or that they or I are dehydrated from the diarrhea, I realize I could have prevented this. I'm over the stupid conspiracies. It's time to be rational and protective. It's not worth being stubborn like I did." That regret, that plea to not follow in his footsteps, that's the common narrative emerging in many pockets of the country dealing with the worst outbreaks right now. The 10 states with the highest new case counts in the country are also now the states with the highest increase in first shots administered. That has been the trend for the past 3 weeks now. Overall, the average pace of vaccinations across the country is steadily rising once again. Look at the bottom right of your screen. People are scared, and without full protection from the vaccine, they've got good reason to be. According to data kept by Johns Hopkins University, we just crossed the threshold of 200 million coronavirus cases across the globe. And with the Delta variant dominating, that number just keeps rising. The CDC now reports that the Delta variant accounts for more than 93% of COVID infections in the U.S., and that number is as high as 98% in certain regions of the country, like the Midwest. But in all the bad news, there is at least a shred of good news, too. California was one of the first states where cities, businesses, and venues imposed sweeping vaccine mandates. And it's working. That state has just seen a significant bump in the number of daily vaccinations. That number keeps rising after months of decline. That is and what can happen when a state takes this seriously. We're also starting to witness what happens when a state does the exact opposite. Florida is in the middle of another record-breaking week of the coronavirus spread. That state's COVID hospitalizations are 13% higher than the previous peak in July of last year. 84% of all the state's inpatient beds are full. More than 86% of all ICU beds are occupied. The state actually broke the hospitalization record for the third day in a row. Florida now accounts for 16% of the country's new cases. It only makes up 6.5% of the country's population. So you can do the math here. This is a state clearly in trouble. When it comes to how to solve this problem, Governor Ron DeSantis is having trouble balancing this equation. During a press conference yesterday, DeSantis downplayed the growing crisis in his state, claiming that hospitalization numbers are lower than last summer and saying the media is promoting, quote, hysteria around COVID. Fast forward to today, the governor is deflecting his poor performance on COVID by pointing to President Biden's handling of migrants at the border. Because in Ron DeSantis' Florida, 1 + 2 = 751.
Joe Biden has taken to himself to try to single out Florida over COVID. This is a guy who ran for president saying he was going to, quote, shut down the virus. And what has he done? He's imported more virus from around the world by having a wide open southern border. So why don't you do your job? Why don't you get this border secure? And until you do that, I don't want to hear a blip about COVID from you.
Rather than doing anything about the rising hospitalizations in his state, Governor DeSantis is using this moment to fundraise. Literally, this is a fundraising email sent to supporters this afternoon. Quote, friend, Joe Biden wants me to get out of the way because I refuse to yield power to the federal government and strip Floridians of their liberties. Until Joe Biden gets the border secured and this crisis under control, I do not want to hear a blip about COVID from him or his administration. Chip in now to help me continue my fight. Help me continue my fight, not the fight against COVID, the fight against Joe Biden. Meanwhile, his hospitals are creeping dangerously close to capacity since no amount of fundraising can help the COVID spread from spreading. Joining us now is Dr. Marcos Mestre. He's the chief medical officer at Nicholas Children's Hospital in Miami. It's the only freestanding pediatric hospital in South Florida. Dr. Mestre, thank you for being here tonight. One of the reasons we've got you here is because your hospital is experiencing how serious this is. I just want to read to my viewers. At Nicholas Children's Hospital in Miami, there were 17 patients with COVID-19 on Friday, including 6 in the ICU and 1 who needed a ventilator. That's what you told the Associated Press. About half of the patients were under 12, Mestre said, and the rest were older and eligible for vaccine. But none of the patients with COVID-19 on Friday were vaccinated. You are seeing this at your hospital. You're seeing it around your state.
That's exactly right, Ali. What we're seeing now is we're actually up to 20 patients. We got 16 patients on the floor, 6 in the ICU, 10 on the regular floor, and we have another 4 waiting in our emergency department to be admitted to the hospital. So we're definitely seeing an increase in cases, not just admitted to the hospital, but also in our emergency rooms and our urgent care centers across the city.
And again, you are a children's hospital, but we seem to be seeing, at least anecdotally and statistically, that there are more young people being hit by this right now. What's your sense of how that is, why that's the case?
Yeah, definitely there's a higher percentage of children that are affected, given that the older population is vaccinated. And obviously for those 12 and under, they cannot be vaccinated. So there is a greater percentage of children that are affected as compared to at the beginning of the pandemic. But in regards to the raw numbers, we're not quite at those numbers that we saw in July of 2020, but we're getting close. And with this peak possibly lasting for 2 to 3 weeks, we could surpass it.
What do you want to be done? What do you want authorities to do? And what do you need people to do?
Well, what we recommend for everybody is obviously the vaccinations, and that's our way out of this pandemic. And for those children 12 and over, as a father of 3, I completely understand why parents are a little cautious about it. And what the other thing I like to tell parents is that this is very safe. Even though there were some cases initially of myocarditis reported, these cases were very mild and resolved with typically just run-of-the-mill anti-inflammatories. And the effects that we see from a COVID infection, those risks are much greater than the benefits of receiving the vaccine. And for those that parents of children that are under 12 years old, to please get vaccinated yourself to protect your child. If not only to protect you as a parent, but also to protect your child. And finally, for those that are 12 and under that can't get vaccinated and are indoors and maybe around other people in large crowds, the importance of wearing masks. And those are the 3 points that I would love to get across to the members of your audience.
And the mask thing's an issue because some of the states have some of the schools in your state have backed away from mask mandates because the governor has come out against them.
Sure. And again, from our standpoint, our job as experts is to recommend what's best in terms of the safety of the children in our community. We don't get into the politics of the issues, but recommending the safety for the kids in the area. And perhaps earlier in the pandemic, when we're dealing with a different strain of the virus, the spread in children wasn't necessarily a concern. This Delta variant is different. As the CDC, this is a different ballgame. And what we need to do is protect the children and those around them by wearing masks, especially while they're indoors.
Protect the children. That's a good enough reason, I think, for a lot of people to put the mask on. Dr. Mestre, thank you for being with us. Thanks for the work that you and your colleagues are doing at the Nicholas Children's Hospital in Miami. We appreciate your time tonight.